I'm Beki Garrett. I'm the PA here at Ear, Nose, and Throat Consultants, and today we're going to talk about nosebleeds and how common they are and what you can do at home and then what you need to come see us for. Well, at home, if you've got just a little bit of a nosebleed, you can apply just some pressure. If it's just a little blood tinge on your Kleenex or something like that. If it's actually running out of your nose, what we recommend is buying some Afrin at the grocery store or the pharmacy. You spray that in your nose several times, then you soak a cotton ball in the Afrin, put that in the end of your nose, and then apply pressure over the side of the nose that's bleeding. Let it sit there for about 20 minutes or so and see if the bleeding will stop for you. If you're still not getting stopped and you still have profuse bleeding, you need to be seen by an ear, nose, and throat specialist, or you need to be seen in the emergency room so that this can be dealt with. If you come to our office here, or any other ENT office, typically what you can expect is that your nose will be cleaned out using some kind of a suction to get the bleeding down so we can see exactly where it's coming from. If it's coming from the front of the nose, which is the most common spot for you to have bleeding, then we can usually anesthetize that part with some spray and some cotton soaked in numbing medications. And then we treat that area either with silver nitrate or electrocautery, depending on the cause of the bleeding. Then you can expect that you will go home with a little bit of ointment in there. And at home, you're going to be using nasal saline spray or gel 5 to 6, maybe 7 times a day. I always tell my patients you can't use too much nasal saline. You could use it 50 times a day and I wouldn't tell you it was too much. And then you're going to use some kind of most of the providers here at our office will also send you home with some kind of an ointment that you're going to apply to your nose. You put that into the nose using a Q-tip, and you get just the end of the white part of the Q-tip gooey with ointment. That goes into your nose, and you make little circles in the end of your nose. That allows you, so just this part of the Q-tip is going to get full of the ointment, and then it goes into the end of your nose, and you just make little circles in both sides of your nose. That's as far as it needs to go back. You don't shove it way back in your nose because you're actually risking causing more bleeding if you stick it all the way back in there, or you're going to loosen the scab that we caused. The whole point in doing cautery is to cause a scab to form over the surface of the bleeding vessels, and then for it to heal up underneath, scarring over those vessels, forming a permanent seal, and hopefully then ending the cause of your bleeding. If you go to the emergency room, it kind of depends on the experience of the provider you're seeing. A lot of times they'll put in a pack. The packs can be big and bulky and somewhat uncomfortable, but they do stop the bleeding. So if you're having a lot of bleeding, we need to get that stopped, then the emergency room, if it's the middle of the night, may be the best option for you. If you've tried the Afrin and you can't get things to stop, then you go to the emergency room, they're going to put a pack in. They're going to tell you to come see us in the office. Some providers in the emergency room have done this enough that they'll actually try cauterizing in the emergency room and then ask you to come back to the ENT and see us here. But you can expect either a pack or a little bit of cautery, but most likely it'll be a pack that we then have to take out in the office.